So Mallorie, thanks for going over the paperwork with me, and especially I think it's important for us to talk about confidentiality, so I'm glad I was able to answer your questions about that. So here's what I'd like to do in our first session today is I want to get a chance to hear a little bit about the problem that you've been having, and also just get to know you a little bit. And then I want to make sure you get to ask me any questions you have about me. And then before we finish the session today, to hopefully have a good idea about kind of how we might work together if you decide to come back.
Okay.
Is there anything besides those things that you think we should make sure to talk about today?
I think that's most of the ground that I wanted to cover. I just wanted to give you an idea of like what I think I'm dealing with and make a game plan for what I don't even know where to start. So
Okay, so to you, it sounds like it'll be a good session if you're able to tell me a bit about the problem and maybe even start to formulate a game plan.
Yeah, like if by the end of the hour we can like, I can feel like I have an idea of what to do, even if it's something small, that would probably be more helpful than not, so.
Okay,
thanks.
All right. So Mallorie, why don't we just start by you telling me just a little bit about the problem, and then I'll also have you kind of give me some additional information about you and your family.
Okay. So I was interested in seeing you because I have like a 15-year-old kiddo, a boy, and I've been having a lot of trouble with him within the last year or so. Ever since he started high school. He's a freshman, and I've always kind of had a really good relationship with him growing up. Like I feel like we're pretty close within the last year or so. Things have kind of been tense, to put it mildly. He has depression, I believe. It's not quite diagnosed, but like, you know, I was kind of hoping it might have been just something that was passing, but it's developed into something where like he's now like experimenting with drugs and like being a bit more secretive than usual and what I'm used to, and like it's just really hard for us to communicate and be on the same page anymore without just kind of, you know, without pretty much getting into some sort of yelling tirade at one another. So that's kind of been that's sort of the vibe of what's happening and why I want to come see you, because I just don't really know what to do about it. I don't know how bad the substance use is. I think it's pretty bad. I think it's getting worse. I just don't have a lot of information to go on besides just all the arguments that we're having. But I know that he got caught at school. He was caught smoking weed in the bathroom. And yeah, the principal was like, you need to go get an assessment for your kiddo. And that's kind of how it started. And it turns out he has like some mental health issues that are probably driving the substance use. And we're still trying to find out more. But I do know that he has a substance use issue, drug issues, and now he's just grounded all the time and is in his room, and like we just argue all the time, and
so the marijuana use, which seems like that's maybe the main thing that you're concerned about in terms of his substance use, if you were going to guess at how frequently he's using, what would you say?
I think if I'm thinking within the last year, and I know that I'm embarrassed to say it, but I think that there's probably been some signs before what happened at school that I just kind of turned the other cheek, you know, and I've smelled marijuana in his room. Like he has been acting kind of like shady and secretive, and I just kind of chalked it up to like, oh, he's depressed and he's, you know, starting high school and high school sucks. So like maybe that's just kind of what it is. And but like I have thought what I smelled marijuana like in his room at night. He has kind of come home like past curfew a few times where he's had kind of, his eyes were really darty, and you know, he's, you know, we have a close relationship, so I keep saying that, but like I'm just so used to him being communicative, so when he talks with me, like I will just want to trust what he says at face value, and then I'll just kind of want to tell myself that like, you know, maybe he's just going through some stuff, and I didn't want to like suspect drug stuff. But then when school happened, it kind of all clicked together that like all this has kind of been going on under my nose, and I didn't really want to think about it that way, and you know, didn't really want to admit that there's something like tense in our relationship that we're not talking about. So Yeah.
Yeah. So this is
Maybe
probably
weekly at least. I don't
okay.
know. Probably
Yeah.
more. I mean, it's so hard to say because I think like I'm now just sort of realizing how much of a problem it's becoming, where I didn't want to really see it before. So.
Well, and it almost seems like it's disorienting to you to not be able to trust him, and just to have the open communication that you've been used to. So
Right.
it's hard to figure out what's going on.
Right.
So it sounds like you were recommended by the principal to get an assessment done. And have you been able to do that?
Yeah, so it was completed, like we got the results in. He was diagnosed with like marijuana use or cannabis use disorder, like moderate, which freaks me out because it means that it's probably more often than I thought. I mean, there was a really limited release of information because he's over 13, so he can determine, you know, so I mean, pretty much like they were allowed to talk with me that like that assessment was done and, you know, to help make recommendations, but I don't have access to anything beyond that. So there I'm in the dark. So
Yeah.
it's the story's sticking.
Yeah.
There's other stuff probably.
Okay. So the assessment was helpful in that it kind of reinforced what you thought might be happening.
Yeah.
Okay. So I just want to back up a little bit, and I think I have a good idea of the concern that you have and what's been happening, and I'll address that more in a minute with you. Can you tell me a little bit more? I'm just kind of drawing a map as you're talking to me about who's in your family. Who else lives in your household? Is it just you and your son?
Yeah, it's my partner with us.
Okay.
And then I have a younger, so you're younger.
So about 12, your other son?
Yeah,
Okay.
12. Just like he's in the 6th grade. My son's in freshman in high school. My husband is also in the house.
Okay, and is your husband also your son's father?
Yeah.
Okay. Okay. And how long have you guys been married?
For about 10 years or so.
Okay. And do you mind if I ask what you and your husband do for work?
Yeah, I'm a social worker, and then my husband's a teacher.
Okay. Okay. Anything else that you think I should know in order to be helpful to you about this problem you're having?
I don't know. I think one of my questions is just sort of like, am I thinking of the right things to do when I'm trying to like set boundaries with him or implement consequences? I've done grounding. I've done taking away his phone, turning off his data, which, you know, like, which I feel like most of the parents I know do, but I feel like with him, it just just is more explosive. So I don't even know if I'm doing it right. So that's just kind of one question that came to mind just now as I was talking, as if like
that's great.
Yeah.
Yeah, so that's a great question, and something that I did pick up on you mentioning earlier, that you'd grounded him. It sounded like numerous times, and that's one of the things I'm interested in today, is hearing more about the things that you've already tried. So you've tried grounding him. It sounds like you've tried removing the phone privileges or other things as a consequence or a punishment. Anything else that you've tried? Oh, and you've went and got an assessment, which was recommended. That's something else you've tried. Anything else you've tried as part of addressing this problem?
I mean, I've tried just sort of having a sit down talk with him, you know, but then that always seems to escalate into just a shouting match. Turning off the data. Like there have been instances where he will refuse to give me his phone and he'll cuss at me and like get really like loud and puff, puff his chest up. I meant to say, like, he's really postury with me, which is really kind of scary. And then he won't hand over his phone, so I'll just turn off his data, and that pisses him off. And
okay, sounds like you guys are really locked in conflict right now. So I wonder, just because you mentioned his kind of puffing up and getting upset with you and kind of having some kind of big behaviors, are there ever times where you're scared for your safety with him?
I mean, that one time where he kind of postured up to me and got really close to my face, that was really scary. But I think that's it. You know, he kind of, I don't think he was quite himself. I think he probably might have been a bit intoxicated, drinking maybe.
Okay.
So yeah, there's that. I forgot to mention the alcohol. There's probably that. But
okay. Has he ever hit you, pushed you, or hurt you?
Thankfully, no.
Okay. Okay. So just as we continue today talking, and certainly if we meet again, anytime that if there's anything I ever ask you to do, and when we talk about strategies that we might try that you feel is unsafe for you, or if anything ever does happen where you are worried about your safety, then please let me know, because certainly I don't want to ask you to do anything that that's not helpful or doesn't feel safe.
Thanks.
Okay.
Yeah. Okay.
Okay. So what I'm hearing is that you've tried quite a few things, kind of really kind of sounds like focused in kind of the punishment category, grounding him, removing things that he likes, trying to take away his phone, kind of other punishments. And that's what you're seeing other parents do, and probably things that have worked in the past when he was younger. But it seems like right now, it's not quite getting you the results that you're hoping for. And in fact, kind of is escalating conflict between the two of you.
Right.
Okay. Okay. Well, that helps me get a good idea of kind of what's been going on in terms of problem, and then also kind of attempts that you've had at what you've tried so far. And it sounds like you're trying a lot of things.
Yeah, I think.
Okay. Okay. So one of the things I'd like to have time to do is to kind of explain to you, I know you probably read about craft on my website when you were thinking about talking to me, and we talked about that a little bit on the phone. But I want to be able to explain it to you so that you leave today really having a good idea of what we would do if you came back to work together, so that you can kind of make an informed decision for yourself about whether this seems like the right fit. Can we take some time to talk about that?
Yeah, I think.
Okay. So there's a few things I want to tell you about what craft is. I, in my practice, work with families just like yours. So families who are concerned about somebody else's substance use. It's not unusual that you also have concerns about your son's mental health. Those two often go hand in hand together, and is not a problem in terms of using this approach. And it was really designed to help someone like yourself, the concerned family member, to get the person with the substance use disorder to accept help for their problem. And you're already halfway there because you've done the assessment. And so what this is designed to do, this approach, is to utilize the relationship. So that's with you. You're the person that knows him well, who has the good relationship with him, and to use that relationship in order to try to influence him to get help. And what the research tells us is that for even people who their family member is absolutely refusing treatment, that almost 7 out of 10 of the family members who learn this approach will have success in getting their loved one to accept help. So there's no magic bullet here, and I obviously can't guarantee what will happen. But I do find that it's a pretty effective approach. And this approach has 3 goals, really. One is to reduce his substance use. The other is to influence him to accept getting help for the substance use problem he's having, which also would include, in your case, help for if he's having trouble with his mood, if he is depressed. And then the third goal is for you to support you and your well-being. A lot of people who have been concerned about a family member, especially for the last year, like you have, also find that they're experiencing some anxiousness or having trouble with their mood, or maybe isolating from friends or having some other problems because of their worries. Has that been something you've experienced?
Yeah, I feel like I've never been able to think about much else besides wanting to fix whatever's happening. And yeah, it's been a problem. I'm embarrassed, like aside from all the other parents that I've been talking with who I know have similar issues, which is maybe a small few. I just don't, I haven't gotten to the point where I feel okay talking about it yet. It's still kind of, I think, new to me, and I think I'm processing it, but yeah, I just haven't been able to. You're probably one of the first few people that I've actually been trying to figure out a plan with.
Yeah. Well, I think that's a great step then that you reached out and scheduled this meeting, because I do see a lot of people that have had this problem go on for a lot longer before they talk to anybody about it.
Mhm.
So these are the 3 things we would work on all at the same time. We would be working on treatment engagement for your son, trying to get him the help that this assessment says that he needs, working to reduce his substance use in the meantime, and to support you and your well-being. And we can do all of those at the same time.
Okay.
Any questions about that part of just what we aim to do here?
I think like it brought to mind what you said about just sort of getting him to accept help, because like I said, I don't have a release of information to see that whole like recommendation letter. So like I know like I dragged him into the assessment, he was able to do that, but him knowing that the next step is probably a recommendation, and knowing that he got a diagnosis, I know that there has to be some sort of recommendation for him to get help somewhere, and
yes,
walking me out of those results. So I feel like I'm kind of at a standoff with him.
Yeah, and it may not feel like a success because you had to drag him in there, and I'm sure there was a lot of conflict and it felt negative. But one of the things that we'll look at, for example, is the successes you've already had. And you've already had a success here, which is that you were able to get him to go do this assessment, even though he didn't want to. And so there's something that happened there, and we might be able to look at that a little more closely in future sessions to figure out what could we do again in order to help him get the next step.
Okay.
So because some families have not been able to get as far with this as you've been able to get to so far without any help at all.
Okay.
Okay. So I want to go over just some of the premise of how CRAFT works and see if this resonates with you. So the idea one, as we talked about, is that this is for families who have a treatment refusing loved one, which you do. So this will be, certainly this is designed to help you. And I feel really confident about us being able to work together. I've worked with a lot of parents of teenagers like yours, so this is not new to me. And I've really been able to see how this approach helps people with all of those goals at the same time. And I think sometimes, especially for moms, it feels like I can't feel better until my son's better. But in fact, I do see that even through this process, before things change for your son, that people can kind of get a sense of happiness or peacefulness for themselves. So I'm hoping that will be one of the outcomes for you as well. So one of the things that we're not going to do that's a little different than other approaches is that we're not going to be working on ideas like detachment or confrontation. So you've already had a lot of confrontation with him, and that hasn't quite got you where you want to go. So we'd be trying something different. So this is like a relationship positive approach. And this might be a great approach for you because you've had a history of having a great relationship. And it sounds like you have a history of good communication. So you have some of the things, those are assets here, not negative. And so we'll be using those things in this approach.
Okay.
Also, another thing that we'll be doing is that I'll be asking you to do homework after some of our sessions, because this is skill-based. So we're going to be learning skills together. And then I'll be asking you to practice things at home with him. So that might be, for example, practicing a communication exercise that we might do together. So these are going to be kind of behavioral principles. And the idea is not that I can teach you to control him or to make him do something, but more the idea that when we're in relationship with another person, that we influence each other. And so there are sometimes with substance use problems, ways that families are accidentally reinforcing behaviors that they don't like, for example.
Okay.
And so we might look at how the two of you interact with each other around some of his substance use problems. So we can make sure that we're not reinforcing behaviors you don't want, and that we make sure that we are rewarding and reinforcing the behaviors you do want.
Okay.
So just as an example from something you already told me, in the communication skill that we work on together, one of the things we'll identify is what are good opportunities for discussion. And just like you've identified, there are times when you have had negative interactions with him trying to communicate, and you've realized he's been intoxicated. So that's an example of part of the communication skill, is that when he's intoxicated, probably is not a great opportunity for us to practice that skill.
Yeah.
Okay. Any questions about things I'm saying so far?
No, that sounds like what I need to go over with
Okay.
you. Yeah.
Okay. So this isn't really a kind of cookie cutter approach. It's not necessarily that we'll work through kind of 1 through 10 steps at each session. It really kind of depends on what you tell me is going on at home, and then we'll work together to find out, to figure out together what skills we should work on first, ones that hopefully will be useful to the problems you're having right now.
Okay.
And so some of the things that we might do, for example, I mentioned a communication approach that we'll try together. I'm guessing, because you've had good communication with him up until recently, that you probably already do some of the things that I'm talking about.
So, yeah.
And so part of this will just be figuring out what's working and what's not working, and helping you to do more of what is working, and to find replacement behaviors for the things that maybe are not working as well, especially in kind of what's locking you guys into so much conflict.
Right.
Because that can't feel good every day.
Yeah, I feel like I'm just getting to a point where I just feel really burned out on him. So anything that I feel like used to work, I just don't have the energy for, you know? So, yeah.
Yep. Okay. So I think I've given a good overview here, hopefully, that you can know what to expect if you come back. So one of the things that we'll do if you decide to come back for the next session is just to talk over the problems that you're experiencing right now that are causing the most distress to you, and to figure out kind of where to start so that we make sure this is useful to you right away. And one of the areas that I'll want to focus on pretty early is on the treatment engagement part, because you've already taken some steps down that road. You're already partway there, that he's had the assessment. But we won't have to jump into that right away. I'm not going to ask you to do anything this week around the treatment engagement part. We'll work up to that with some of the skills that we're going to work on. So you don't have to go home today and try to get him to tell you anything about the assessment. We'll work on that together.
Okay. I think that's probably the thing that's at the forefront of my brain is like how, like what's going to be the next step now that we have this done, and like, you know, where's the window of opportunity that I should be like, you know, taking advantage of.
Yeah, I mean, I think you're asking the right questions, which is, you know, what are the steps to take? How will you recognize the opportunities as they come? These are the exact things that we would work on together. And in fact, I think right now, because I'm hearing the kind of sense of urgency to get going, if you'd like, I could even give you some homework today that you could work on between now and next time. I mean, assuming you want to come back, would you be interested in coming back next week?
Yeah, definitely. I think there's a lot to work on for sure.
Yeah. Would you like me to give you some things that you could work on that could help kind of outline the next steps for us?
Yeah, I think so.
Okay. So what I'd like to do before we leave today is to give you some ideas of some places that, just based on what you told me, that the assessment said that he has a moderate substance use disorder related to his marijuana use. That I could give you some ideas of places that he might go for treatment once he accepts help, and that you could do that research ahead of time. In fact, that's part of one of the skills that we would work on, the treatment engagement skill, is for you to identify some treatment options that are affordable to you, that are taking new clients, and that you would feel comfortable sending him. And that I'll have you do that research before you ask him to do anything. So if you're feeling like you are kind of raring to go, I'll give you some of those names of places today, and I'll just ask that you talk to some of the staff at each of those places before we talk next time. You want to do that?
Sure, and to do the research before I talk to him about it, right? Like,
yeah. Okay. So all I'm asking you to do for the homework is to call the places that I'm going to give you a few resources, and I'm going to have you call and get some questions answered about like cost and what the program is, so you can get a sense of what's available. And then I'll ask you not to say anything to him about it at all this week, because you and I will plan how to do that together.
Okay. That's doable.
Okay. Okay. Any questions that you have for me before we end this first session today?
I think that pretty much covers it. I was able to ask you earlier, so.
Okay. And I know I'm just looking over my notes about kind of your that your hope for this first session, it sounded like, was about kind of me being able to find out a little bit more about you and your family and what's been going on, and to try to start talking about a game plan.
Yeah.
So did we feel like we did enough of those two things today?
Yeah, like I have an idea of like the next few steps I should take, so that's helpful.
Okay.
Yeah. Thank you.
Okay, great. Well, then we'll end here, and I'll write down the name of the resources I want you to look at before you leave, and then we'll pick it up next week.
Okay, that sounds good.
All right, thanks, Malorie.
Thank you.
Okay.